For years, you've been told to act fast when it comes to stroke. As May is National Stroke Awareness Month, not only is it a good time to increase your knowledge of stroke symptoms, but it's also a reminder that when it comes to stroke, everyone should be fast.
Befast is a tool that we use to help us remember the signs and symptoms of a stroke. B is for balance, loss of balance or dizziness. E is for eyes, visual changes. F is for face, facial drooping, severe headache. A is for arms, like arm weakness or arm numbness. And S is for speech, slurred speech, trouble speaking, or confused speech. And T is for time to call 911 because treatment is time sensitive.
These 5 common symptoms of stroke are not unique to stroke, but if they are sudden and out of the ordinary, they may indicate a sign of stroke and require immediate attention.
So if you're experiencing a stroke, you have brain cells that are dying. In fact, 1.9 million brain cells die every minute during a stroke. Treatment is time sensitive. Delays in treatment can increase the risk of death or permanent brain damage. Fast treatment can reverse or help save brain tissue to reduce disability. 55% of our patients don't arrive in time for treatment, and this is why it is so important to call 911 for an ambulance. An ambulance is not just a fast ride. They begin assessment, treatments, and communicate to the stroke team so we can be ready to treat as soon as the patient arrives.
Strokes can happen to anyone at any time. There are a number of risk factors for strokes, such as age. 1 out of 5 who experience a stroke are under age 55. Race, African Americans, Hispanics, and Asian Pacific Islanders have a higher risk. Gender, more women have strokes than men, and more women die from strokes than from breast cancer each year. And family history, you are at a higher risk if a family member has had a stroke.
High blood pressure doubles the risk of stroke. Atrial fibrillation is actually a fast heartbeat, and it comes from the top of the heart. It increases stroke risk 5 times. High cholesterol, diabetes, smoking, obesity, and lack of physical activity are all risk factors for stroke. It is important to see a healthcare provider to assist with medicines and help manage your risk factors. You should stop smoking and begin a healthy diet and become more active.
Educating yourself about stroke can be a life-changing event for you or a loved one. That includes not only knowing the symptoms, but where to seek treatment.
So we are a primary stroke center by Joint Commission standards. We will also be receiving the American Heart Association Get With The Guidelines Stroke Gold Plus Award for the 4th consecutive year. This award recognizes the hospital's commitment to ensuring stroke patients receive the most appropriate treatment according to national recognized research-based guidelines supported by the latest scientific evidence. The goal of these treatments is to speed recovery and reduce death and disability for our stroke patients. One of the measures in which we are consistently meeting the goal is DOOR to TPA. This is the time-sensitive clot-busting drug. For eligible stroke patients, we are treating on average within 35 minutes of arrival.
For more information about stroke care at Rapides Regional Medical Center, visit rapidsregional.com.